On today's discussion on the neck wreck, we'll be talking about how to prepare yourself for surgery on your disc replacement. Well, hello everybody and welcome back to my channel. I'm Mike, your host. And today again we're talking about things you need to do to prepare for before you step into that surgery room. Now, I've already talked about some of the symptoms that I incurred in my video before, and a link to that will be in the description below. So today's video we'll be talking about preparation, so let's get started. First of all, if you're just tuning in, you've probably already done this, but the thing about it is you need to select a surgeon. Now, if you already have a great surgeon, then you can miss this part of it, but for those of you that are watching for the first time, you want to make sure that you select a good surgeon, a surgeon who's going to treat you like a human being, and it starts with that initial phone call. If the person answering the phone does not make you feel warm and fuzzy, you need to move on. But let's say that you do and you visit with a surgeon. That surgeon needs to come in, sit down with you, and make sure they treat you like a person and not a number. Make sure they're answering all the questions that you have. This is a very, very important decision. And you need to make sure that you're comfortable with the things around you, the people you're talking with, and everything that's part of this process has got to be to your liking. Remember, if you don't have that loving feeling, you need to get the heck out. Also, make sure your surgeon is in your insurance network. I've talked to a few people that found somebody great, went to check on it and realized that they wasn't covered under their insurance. Your company will help you determine that. So don't forget that little process either. Now, one of the things that I want to do, and this is not a sponsored video, but I wanted to give credit to my surgeon, Dr. Neil Shaw. His organization, his people, the hospital that he operated in, everything was top notch. But most importantly, Dr. Shaw made me feel like a person, made me feel comfortable, and I will link all of his information in the description below. And by the way, I'm in the Dallas-Fort Worth area for those of you that are asking. So if you're in this area or maybe some surrounding states and you need a good surgeon for your neck or spinal cord, please do yourself a favor and contact Dr. Shaw. Now, moving on from that, remember, your surgery is going to be a day surgery. So you're going to have surgery in the morning and your recovery will be in the afternoon, and then you're going to be sent home in the evening. And at that time is where things need to be really prepared for your success. Now, one of the things you need to do right off the bat is make sure you have a driver. I can't tell you how many times I've read stories about people who think they can have surgery of this nature and then get in their vehicle and drive themselves home. It's not going to work that way. Make sure that you have a driver, and know in this day and age, Uber is not going to work. You need to have a friend or a family member bring you home. But when you get home, these are the things that you need to keep in mind. First and foremost, you're not going to be able to sleep in your bed in a horizontal position. Yes, people talk about the fact you can prop yourself up, and I'll tell you in just a second why that's a bad idea. What you do need is a comfortable chair or a couch to sit in. Remember, this is where you're going to be for the first week or two, and you want to make sure it's comfortable and sleeping the best you can. I know there's going to be challenges to this, but remember, you had surgery to the neck area. The reason you're sleeping upright is you're letting the swelling drain and things in your neck drain, and that way it'll be the most comfortable for you. So good, comfortable chair, a good comfortable couch. I tell you, it'll go a long, long way. Another thing that you need to worry about is the fact that you're not going to be eating solid foods. And I'm telling you right now, you're not going to feel like it, especially the first couple of days. But you're going to be on a liquid diet for probably the first 2 weeks. Now, when I say liquid diet, I mean liquid diet, soft foods, things like protein drinks, puddings, jellos, applesauce, yogurts. And one of the things that I ended up getting was this thing here by Premier Protein. Again, not a sponsor, but this is a very good thing to have. These are pre-made shakes to throw in your refrigerator and take care of your business. But if you choose something like this, also remember something too. Your neck is going to be kind of in a locked position, and they're not going to want you to tilt back. So tilting back and drinking this is not going to be something that's going to be fun. So what do you need? Well, your trusty dusty bendy straw. This little device here is going to go a long way for any drinks that you have. And believe you me, because of the angle, you'll be able to take care of business and not articulate your neck in a position that could be painful. So those are the things to keep in mind. Also, you're seeing a common theme here when I'm talking about food products. They're all cold. Remember, they're going to do surgery in the front of your neck. They're going to remove your esophagus to the side, and they're going to do surgery in the back of your neck. That's going to cause a little trauma. And there's a reason why you're in a liquid diet or soft food diet is because of the fact you may have a little swelling in this area. The cold foods, like a smoothie, again, a cold pudding or something like that, is going to soothe your throat. Also, people talk about a little irritation. For those of you that have been through surgery before, having that tube down your throat to help you breathe during the process. All these things help. I really would, in my opinion, avoid any hot foods the first 2 or 3 days. Cold foods will be something that'll be a much better process for you to have. Also, ask your doctor, do you need any prescriptions filled? You're going to be on some pain medicine for a while to help things. You may be on some muscle relaxers or anything else that you have. Also something too, maybe you're already on prescriptions, things for high blood pressure, cholesterol. Remember to get all these things filled before you have surgery. That's one less thing that you have to deal with. The last thing you want to do is be dealing with any pain or discomfort, and you go to reach for something that's supposed to help you out, and it's not there because you forgot. During the surgery process, afterwards, as you go home, make sure you bring some loose clothing. A big shirt, big sweatshirt, even something better, something zip up. Again, you don't want to be struggling with anything tight fitting. It's not going to be very comfortable for you to wear. Also, those things are not very comfortable for you to wear after surgery. I was probably in my best shape by wearing sweatpants, kind of a loose muscle shirt, a zip up sweat top. Now, I'm making this video in the wintertime, of course, but anything like that to help you recover. Loose clothing as far as your shoes are concerned, slip-on shoes. I wouldn't worry about socks, anything like that. You'll have a better understanding of this as you get into the process of the surgery, but make sure you have those items available. Again, make you more comfortable. Ice packs. Ice packs are important. You normally get those from the surgical hospital, but don't assume that you will. Go ahead and go out to your local store and get you a couple ice packs, throw them in the freezer. Those are things that are also very important. Now, we're going to have a little fun here on the next thing, but think about this, guys, gals. You've had surgery on your neck, and the doctor is going to want you to change your dressing very often. Now, I don't know about you, but I'm not real fond of that tape that they put on the neck. It's irritating. You have to peel it off. Men, you've got hair down there in your neck. You're worried about shaving, all this jazz. One of the things that I found, and I kind of found it by accident, was, okay, you ladies know what I'm talking about here. And I'm talking about this right here, a panty liner. Now, you're going to be wearing one of these afterwards for most surgical procedures, and especially one on the neck. This is a soft collar. And the last thing you want to be doing, again, is worried about your dressing. Believe it or not, this right here has a sticky back. You stick it to the back of your soft collar, you put it on your neck, you're good to go. The good thing about this is it is sanitary. At the end of the day, you peel it off, you put a new one on, and you're ready to go. Again, we can laugh about it, but I'm telling you right now, this is something that comes in very handy. So something to think about as you're going through the process there. Also, things in your bath. Now, the first couple of days, it's going to be relegated for you to take sponge baths probably out of your sink. But eventually, you get in the shower about 2 or 3 days later. And again, remember, you're not going to be able to bend down. So one of those little scrunchy things on a stick, that really come in handy for me. That way I could address the areas of my body without having to worry about bending over or articulating my neck or articulating my back. It was just something that made things very simple. And again, something to think about. Buy that beforehand. Little things like make sure you pull your shower diverter up. That's right. You go in and you hit your knob and you have to pull that shower diverter up off the bottom. Well, again, you can't bend over to do it. Do it beforehand. Leave it up. And that way your shower is on all the time. You don't have to worry about that. Another thing too, personal hygiene issues. Right before, do things like clipping your toenails, your fingernails, shaving for those men like that. Things that you don't or think about for 2 weeks you're not going to be able to do. The last thing you want to think about is 3 days in you realize that your toenails are hurting you and you have to address them and you can't reach them to do so. I know that may sound crazy, but believe you me, it'll make you a lot more comfortable during the process. We talked about drinks. We talked about the fact of medications and so on and so forth. But most importantly, make sure these things are at waist level. Remember, if you take your little pre-made drink here and you go in the refrigerator, look at the shelf that's at waist level and then clear it off and put all your cold foods there, your puddings, your jellos, your apple sauces, your yogurts right there. The last thing you want to do again is bend over, open the refrigerator. It's right there. Grab it. Take care of your business. You don't have to struggle with figuring that out. Same with your prescriptions. Make sure that they're on the counter. They're not up high in the cabinet, out of reach. Everything should be an easy reach for yourself. Again, this will set you up for great success. Also something too that I've encountered with some people, make sure you have a 2-week follow-up scheduled with your surgeon. I say 2 weeks because I'm telling you, ladies and gentlemen, this is a magical mark in your time frame. That's when this, like we say, this little cervical collar, well, it can come off your neck. You're able to eat foods. If you're recovering well, you'll have no restrictions. You'll be able to sleep in a more horizontal position in your bed without having any problems with that. In other words, if you're recovering well, after the 2-week mark, a lot of these things are taken away from you, and you're going to want to make that mark. Let's see what else can I think of. Oh, last but certainly not least, follow your surgeon's instructions. Now, ladies and gentlemen, this isn't the time 3 days in, you feel great, your pain medicines are going well, and you decide, hey, I'm going to go do something crazy. Don't. Follow your surgeon's instructions. Remember, after the first day, you may not feel like it, but you need to get up and walk around. Do not stay sedentary. They will stress this to you because remember, you're going to have surgery, you're going to be in a reclined position, and they're going to be worried about blood clots in your legs. Walk. Everyday walk. It may be just 10 feet, 50 feet, maybe just around the block. But 2 things happen. Number one, like I said, you can address your blood clot issue by walking around, but it also gets the body circulating better, and that way you can heal faster with better circulation. And by the way, if you've had surgery of this or any other kind and you're watching this video and you can think of other good ideas that can help people recover, please leave them in the comments below. We would greatly appreciate that. Now, in the next video, we're going to talk about what happens during your surgical process and immediately after, what to expect. So I thank you very much for watching, and we'll see you on the next video.